So it's actually had a pretty big impact, and I think the issue is that this therapy is a very active therapy, right? I mean, that's kind of what the data we've shown before says, and kind of what this update shows. And so identifying these patients is really critical. We have a therapy now that works extremely well, potentially even cures a fraction of patients, and so we want to find these patients. And so it's really moved into this idea of universal testing colorectal cancer. So all colorectal cancer patients should have MSI testing, period. And so that's really kind of the push that's been put out, and so that testing can be via immunohistochemical staining, via polymerase chain reaction, via next generation sequencing. It doesn't really matter how you identify your deficient mismatch repair or MSI high patients, but we should find those and identify them. And now there's an FDA labeled therapy, with nivolumab. Pembrolizumab is also approved in that space, but really identifying that group is a critical kind of take home, I guess I would say. And then the questions that lead on is, could we do better in that group, right? So that's kind of an obvious question. And then, how do we actually take what we've learned here and apply it to the majority of colorectal cancer patients? Because that's the one big frustration, is this therapy works really well, but it works really well in about 5% of metastatic colorectal cancer patients. So 95% are not MSI high, right? So how do we make headway in that kind of group? And that's a lot of ongoing work to kind of identify how to move forward. And there are some other early kind of signs that we might have some hints of approach, but that's still kind of a lot of a matter of work.